All right, then, well, let's talk power locations in your operatory. That's a place we call critical dimensions, right? You've heard me say it before. We laid out some plumbing critical dimensions for your treatment rooms before. Principles that followed for the last 15 years, almost 15 years now, on placing things, right? We talked about plumbing before. We don't have to have it in the wall necessarily. We can have it, 4 to 6 inches outside of the walls because the cabinet's going to cover it. We have a access panel on the bottom for accessing it and being able to maintain and work on it when we need to. We talked about that. At the toe, depending on the length of the room, 18 inches from the toe wall is where we want it. If the room is 11 foot, or maybe 11.6. But if it's longer than that, then we got to start adjusting that, right? Get with your dental equipment provider on those exact locations when your room is longer. Let's talk power though. This particular office, we typically always have 2 power locations at the 12 o'clock, right? Because you're gonna have a computer, you're gonna monitor, you're gonna have equipment that needs to be plugged in. So we like to put power at 18 inches off the finished floor. And then we like to put it again here at 60 inches off the finished floor, because this can be anywhere in your upper cabinet. Your upper cabinet can move, typically not lower, but more or less higher or so that it ends up in the cabinet. So your CPU has power. Your monitors, if they attach to the outside of the cabinet, have the cords where they can run in there so you don't see them. Now, if you don't have an upper cabinet, then your monitors go right over this. They still block it, up or down. Your CPU can attach to the wall. They have brackets. We've had large form factor CPUs, or we've even had the small form factors that will mount to the drywall here with the bracket. This is always in the cabinet. Now, if we don't have it at 18 inches, we have it just resting on the floor on a whip. This one we have a whip because there's going to be some features that plug in to the cabinet at the bottom, and then we wanted to be able to have one in between the delivery system here in the center. So that's at the 12 o'clock. Now, sometimes these are quad, sometimes this is a duplex, sometimes they're quad, which means that they're double. It just depends on if you're gonna have all-in-one computers, you're gonna have dual monitors, how many devices are you gonna plug into those little contact devices. The contact device, that's a socket or a yoke in electric terms. Anyway, let's talk about the toe. Here's the toe, 6 inches off the center. We like to have common dimensions because it's easier for everybody to remember. Some of you guys like to have them at 84 inches. Geez, sitting in the chair, laying in the chair, the TV is pretty daggum high when you're sitting in there, right? So if you're sitting or laying in the chair, 60 inches is well enough room to be able to move that TV high, low, right, left, whichever way, to be able to hide the power and the HDMI, the Ethernet cable or whatever that goes to that. So those are good dimensions. They're easy to remember. We recommend them. There again, consult with your IT company. They have their own, things they like to follow, practices. So that's up to you guys. But anyhow, if you're trying to lay this out yourself, you can do this. It's easy. Just follow these dimensions. These are just regular. The assistant side has, just another duplex. The assistant side, doctor side, and those are just at 18 inches. That's just a common height in the trade. Anyhow, critical dimensions, power addition, and the treatment room. See you guys in the next one.